Good afternoon, we should say. We are very honored and delighted to welcome Lord Fowler today with us. And thank you, all of you. Thank you to our students. Thank you to our PhD candidates. Thank you to our colleagues to attend. And I also would like to introduce the panel around Lord Fowler, particularly Dr. Mariangela Simao. You are Assistant Director General of WHO. You are here in Geneva for more than 12 years. But before working at WHO, you were at UNAIDS. And Lord Fowler is, how to say, a very interesting and surprising man to be with us today. He is a politician. He is, in fact, a lawyer first. He was in Cambridge, in Trinity College, a student, as you are, a student here in Geneva in law. And he was also a journalist in the Times. He was a very prominent politician. He will probably talk about that because the topic of today is politics and AIDS, and the AIDS and HIV pandemic. And he really, how to say that, dedicate his life in three major domains to end the punitive laws against stigmatizations of lesbian, gay, bisexuals, transgenders, and intersex, LGBTI communities, to ensure the universal access to healthcare and particularly to drugs. You may not remember, you are very young, but it was a fight. It was really difficult at the early times of AIDS. And his third commitment was to empower the education of girls. So this is not so obvious for a conservative politicians to have such a track record with him. So we will be very, very happy to hear about him. Before I give the floor to Mariangela, I would like to introduce our Vice Dean of the Faculty of Medicine, Professor Alexandra Calmy. She's not here only as the Vice Dean and the representative of our faculty, but also she's a specialist of the AIDS and HIV pandemic in the position of a clinician and a researcher. So just after Lord Fowler had spoken, Alexandra will react and will give her own reactions and perception of the topic we are dealing today. So without any more words, I would like to give the floor to Mariangela. Thank you again for coming.
Thank you. Well, good afternoon. It's a Friday afternoon, so I guess we're all very happy. Right? Let me start by thanking UNAIDS for inviting me to represent the joint program. It's a pleasure and an honor, because I worked, like Professor Antoine was saying, I worked in UNAIDS for 7 years, but before that I was the HIV and hepatitis director in my home country, Brazil, so for many years too. So I've been around for a while. And let me also thank the very warm welcome we are having here with a lunch reception and your warm words, Professor Antoine, and thank you for hosting this event. It's very timely that this event is happening and that we have Lord Fowler here. Because we're still trying to overcome major challenges from this pandemic, the COVID pandemic, right? And at the same time, we are sure that there are many other health problems that were on the big agenda before and that are being left behind. And HIV is certainly one of them, right? I also appreciate the title of your talk today, Lord Fowler, because I come from a Latin language. I don't know about French, but in Portuguese and Spanish, politics and policies are the same word. And this I see several people nodding. And this makes a huge difference, because people artificially divide the technical side from the political side. And I always said, you don't do good policies in health if you don't deal with health politics. So these things are intrinsically connected. So it's in HIV more than ever. The decision-making process, I see colleagues over and over again say, no, we need data to influence decision-making. It's not. Decision-making is a political process. That's a better decision if it's informed by evidence and by human rights. So I really appreciate the opportunity to listen to you today. And we know we are now living through, we haven't gone over COVID-19, we have monkeypox affecting the populations that are most affected by HIV, and HIV has taken a terrible toll in the world, right? But as we manage this pandemic and we're preparing the world for the next pandemic, I always cite HIV as the example of inequity in access, right? Because we had a delay of more than 10 years since the first antiretrovirals became available in high-income countries for them to become available where the disease burden was higher. So this is something that I keep all the time. Last night, every Thursday night, we have a meeting of this ACT A group on COVID, and I was again saying, what happened during this pandemic is a repeat, the COVID pandemic, is a repeat what happened years and years, and many times before. We should make sure we put in place mechanisms that do not allow that to happen, that you have timely, equitable access to the drugs, diagnostics, and prevention tools that people need when they need it, not 6 months after, not 10 years after, like happened with HIV. We still have 38 million people, 38.4 million people living with HIV. 75% are on treatment, which is, wow, that's a huge accomplishment. But we still have 650,000 deaths due related to HIV, and we have more than 4,000 new infections every day. So this puts things into perspective. It's far from over. So we cannot let the ball drop, especially because these numbers reflect or hide an uneven world where 70% of the new infections are concentrated on what we call key population or vulnerable groups, right? And that's and their partners, and we need to address this. Of course, it's a lot about dealing with discrimination in human rights, right? And that's where the politics play a large role. And we have young women and girls, of course, affected, but we do have men who have sex with men, people who sell sex, people who inject drugs, and transgender people, and other groups that are mostly affected. And if they are let to be in the normal course of the prioritization for health concerns at country level, they'll be left behind. So this is something that we need to make sure we are always paying attention and not letting the guard down. And then the latest excellent report from UNAIDS in July shows that the official development assistance for HIV has gone down, with the exception of the US, right? In the last decade, it has gone down 57%. So international funding is dwindling. And like I said, not over. And now we have this overlapping crisis, and I say that what was bad before COVID just got worse, and I think the people affected by HIV in all manners of life were badly affected by this pandemic. So inequity is key, and I think we need to work on it. I'd like to highlight 3 challenges. They are not the only ones, there are others, but we need to continue to push for tailored response at country level that don't leave behind these marginalized groups, right? And second, in a context where there are competing priorities for funding, that's what we're seeing. We need to continue to push for a fully funded HIV response because we have the tools and we can end the pandemic as it is, and people should not die unnecessarily. People should not die before their time. I say this for COVID as well, because we still have problems with access to therapeutics like nirmatrelvir. We're still struggling with it, but people are still dying from COVID as well, and when there is therapy that could help them. And HIV is the most clear case. And the third, that we need a more integrated response. I know we are struggling on the HIV field to work around this because there's a lot of talk about health system strengthening, and this is a big basket, right? But without integrating, without reaching out to people where they live, closer to where they live, like, for example, through primary health care, it's going to be very difficult to sustain a response for a chronic disease like HIV now. And Lord Fowler, to finalize, you have been a pioneering, courageous political leader on AIDS for 4 decades. You're just talking about the meeting you came in Geneva. And you continue to be a driving force for bold action to end AIDS. And let me say, we need you now more than ever. So it's not over. Let's keep moving. Thank you so much.
Well, thank you very much indeed. I agree with every word of what you just said. In fact, I thought at one stage it really wasn't worth my while saying anything because it was so good. But let me say, for me, it's something of an anniversary. It's almost 40 years to the month that I came to Geneva to discuss an issue which was causing increasing alarm and concern throughout the world, which was, of course, HIV and AIDS. And I still have the records of that meeting. As my wife will confirm, I do not throw away papers lightly. I have them here. There's a little note in the margin, which I'd added to it, no vaccine, no cure, which seems to me to paraphrase what is required. But at that time in 1986, there were 36,000 cases of AIDS reported from 75 countries. That was certainly a very considerable understatement. The WHO estimate of the scale of the epidemic was 100,000 cases and a forecast toll of anywhere between 5,000 to 3 million deaths within 5 years. And that was an estimate and a forecast carried out by Dr. Jonathan Mann, who I met on several occasions and who was a most enormous loss to this world. So we were then at the foothills of one of the worst epidemics to affect the world. And what I remember most clearly about it is the impotence of helping people who had contracted HIV. There were no drugs, there were no medicines. It was almost certainly a death sentence. I remember at the beginning of December 1986, being in Berlin, meeting a consultant who had lost 8 patients in the last 2 weeks. Everywhere I went, I met doctors and nurses working under enormous strain and knowing that there was nothing they could do but provide the best possible care but not cure. The United States had one of the most serious challenges. A prime example of what was happening was in Los Angeles. I went to the major hospital there. There was one very large ward which was full to capacity with young men, all of whom were in suffering from HIV and all of whom were to die. I was introduced there to a shipping clerk, I remember. For the benefit of the television cameras, we were pictured shaking hands. This was regarded in those days as an extraordinary, revolutionary thing to do. But the idea was to show that AIDS was not infectious and could not be contracted in the same way as the common cold. It was the prelude to a much more influential photograph which went round the world of Princess Diana doing the same a month or two later. The aim was to fight some of the ignorance and prejudice which surrounded this whole area. For those who were already infected, the challenge was to provide the best possible care, and I really pay sincere tribute to the doctors and nurses who so often provided this. In terms of numbers, however, the much bigger task was to prevent the many millions of others in the public from contracting it. And you might have thought that such a policy of prevention, using all the devices of modern communication that we had, which were then available before internet and all that, television, posters, newspaper advertisements, that would have been universally welcomed. Not so, I fear. There were counter-arguments. A popular argument was that this was not a public health crisis, this was a moral crisis. Homosexuality was condemned, and much of the public health measures with it. The chief rabbi in Britain said, and I quote, "The campaign tells people not what is right, but how to do wrong and get away with it. It is like sending people into a contaminated atmosphere, but providing them with gas masks and protective clothing, or instructing thieves to escape being caught." That was perhaps extreme, but it was not that extreme, the kind of expressions being used. And a much supported solution on both sides of the Atlantic was that all those infected should live from then onwards in isolation, flying in the face of even then what we actually knew about the disease. Another policy was to ignore there was a problem at all. I went to the United States, as I said. I met a lot of people there. I met no one who could recall that President Reagan had uttered one word about AIDS in his term as president. In Britain, Mrs. Thatcher was a bit better than that, but was not an enthusiast for my health campaign with posters and commercials and things of that sort. I could put it stronger than that, but she was not an enthusiast. In the main, we managed to manoeuvre around Mrs. T. Broadly, she took the view that the publicity was introducing the subject to many teenagers who knew nothing about it. Now, if the implication of that was then that's going to lead to an increase in infection, it was very wide of the mark. Not only HIV came down, but all sexual diseases as well came down at the same time. That was the impact of one campaign. The easiest thing for me to say at this point is, well, that's just history. But that would not be true. The first and most obvious thing is that prejudice, not just of the public, but also of leaders and politicians, that prejudice continues to this day. Why else would we have a position in which 68 countries, 68, criminalise gay men, which is a disastrous policy if your aim is to reduce infection. It's an obvious barrier to men coming forward to be tested. But for those of us campaigning in such restrictions, we do see some encouraging signs over the last years. I remember being in India a few years ago and being told that Britain was responsible for the prejudice against the gay population. And of course there is some historical truth in that charge. But if you look at the position today, the laws against homosexuality have long since been scrapped. But what is significant is how rights have been extended. And we now have, for example, equal marriage, and that was supported by politicians in all parties. The position is not perfect, but a small revolution has been achieved with overwhelming political support. And what, frankly, we need now are many more small revolutions. So let us be frank. Although we made fantastic progress, we have made fantastic progress since those early days, thanks to the efforts of clinicians, nurses, researchers, and the rest. We still do face today fresh crises. AIDS is the deadliest pandemic of our time. 36 to 38 million people so far died from AIDS-related illnesses. That is a vast toll. AIDS is an emergency where deaths continue now to rise at a rate of 650,000 a year. The fallout from COVID-19 and the war in Ukraine have hit the AIDS response worldwide very hard. The result is that progress against the HIV pandemic has stalled. Risks have increased and resources for the response have reduced. The Global Fund, another groundbreaking organisation, reported that HIV testing fell by 41% across 502 health facilities in Africa and Asia, and harm reduction also shows a fall of something like two-thirds, harm reduction services of two-thirds in the last years. Surges have been reported in gender-based violence, forced child marriages, teenage pregnancies, and violence against and harassment of LGBT people generally has increased, as has stigma and discrimination against marginalised communities. In such a context, LGBT people are pushed further away from vital health services, and these factors increase their risk of acquiring HIV. And at the same time, domestic funding for the HIV response in low and middle income countries has fallen for 2 consecutive years. Globally, the number of new infections dropped only 3.6% between 2020 and 21. In 38 countries, new infections are actually rising. Progress is ensuring all people living with HIV are accessing life-saving antiretroviral treatment. That progress has also stalled as well. So that is some list of what is going wrong. If I may suggest, it is a sober list, but it is not a counsel of despair. It is a call to action. We have come a very, very long way in the last years, as I can testify to. No longer is HIV something like an automatic death sentence. The advances in antiretroviral drugs means that people who are infected can live long lives like the rest of us. We can end AIDS. We know how this can be done. We are not remotely in the same position as we were when I was a minister. But let me now pick out 3 challenges, just as my predecessor speaker was saying, 3 challenges today which where progress is particularly urgent. I think one aspect is education of girls and young women. One aspect of the pandemic and our perception of it has certainly changed since the early days, and that is their position. For years past, we have been used in the public area to conduct much of the political discussion in terms of men and young men, when it is, in fact, it is a challenge which affects women just as profoundly, a position which goes, I fear, too little recognised in general discussion. although the figures show that of the 650,000 cases last year, deaths last year, 320,000 deaths were women, 240,000 were men. Most tragic of all, 100,000 deaths were children under the age of 14. So that is one of the profound reasons why education and the emphasis upon girls' education is placed so high. That is point one. Point two is to recognize the marginalization and discrimination that those things perpetuate pandemics. Laws that punish consensual same-sex relations, in addition to contravening the human rights of LGBT people, are a significant obstacle to providing health outcomes, including the HIV response. Such laws help to sustain stigma and discrimination against LGBT people and are barriers to them receiving health care for the fear of being punished or detained. Personally, if I may just add this, I find it disappointing, again I could put it stronger, that the World Football Championships should be staged in a country where the laws are so discriminatory against LGBT people. Some argue that nothing can be done. These decisions are for sports bodies to take, and they are. But such bodies should not ignore the effect that their decisions can have. I remember the controversy there was in Britain when it was proposed that we should withdraw from the Moscow Olympics in 1980 because of the Russian invasion of Afghanistan. The cabinet, where I was a member, supported such a ban, as did the House of Commons as well. But when it came to it, with one or two exceptions of one of the sporting bodies, the entries went ahead. Few would defend that policy today. So let me I just very briefly put the case against discriminating. When people fear the state, many will hide from it. When people fear public shaming, many will seek to prevent themselves from being seen. 68 countries in the world still criminalize gay men. The repeal of such laws worldwide would help the world end AIDS. And the maintenance of punitive laws is hurting countries' in its ability to end the AIDS pandemic. Countries that criminalize gay men saw less progress towards HIV testing and treatment over the last 5 years than generally. So in times of crisis, some in power have shown a tendency to treat human rights as being slightly in the way. But the evidence is clear. Human rights are not only intrinsic, but they are also the very means by which governments can successfully beat a pandemic. My third point is this, that we can end AIDS, but we can only end AIDS if political leaders act courageously. On current trends, I fear to tell you that we will miss the United Nations target of ending AIDS as a public health threat by 2030. And that will result in millions of additional deaths. But it is not inevitable that we should miss the 2030 target. The manifesto for success, as opposed to failure, the manifesto for success includes the empowerment of girls and women, and it includes the removal of punitive and discriminatory laws. But it also includes international cooperation and support. But sadly, at this moment, when international solidarity and funding is most needed, too many high-income countries are cutting back aid and resources for global health. In 2021, international resources available for HIV were 6%, were 6% down. but lower than in 2010. But when you exclude the United States, whose contribution from a pretty slow start is now, I think, the most generous and the most praiseworthy of all countries. You look at the response from other bilateral donors, that has plummeted 57% over the last decade. That is a pretty awful figure. Wealthy countries need to remember what is at stake. And what is at stake is that hundreds of thousands of deaths and millions of new infections, all preventable. What is at stake is the end of a pandemic and not a pandemic that simply stretches on and on. And I think that beating pandemics is ultimately a political challenge. Ladies and gentlemen, my view is briefly this. We can end AIDS by 2030, but only if we are bold in our actions and our investments. We need courageous leadership, we need courageous political leadership, and we need people worldwide to insist that their leaders be courageous. Whether we end AIDS is up to all of us. It is ultimately an issue of love and death. Thank you very much indeed.
And I would like really to thank you, Lord Fowler, and you as well, because what you said is just, in a nutshell, everything that did happen in 40 years. So it's really a masterpiece of the AIDS history. Maybe I can say a few words about what you said, but it's really difficult to make much better than everything what was said. For me, the history of AIDS started in 1992 when the canton of Geneva, and at this time I had 22 years old, the canton of Geneva decided to do BIPS, the Bus Itinérant Prévention SIDA, in order to do a harm reduction and to provide syringes to people who were injecting drugs. And in 1992, this was, to the best of my knowledge, the first country in the world who really did seriously the harm reduction for neglected population. If we want to say that the AIDS history has been always a history of vulnerable population, wherever you were and wherever, even in a rich country such as Switzerland. So in Geneva, it started with a very small bus, and this bus were going in the places where no one wanted to go, and it stays at night until 2 a.m. And people who injected drugs, but also people who just wanted to receive condoms for free, or some discussions or whatever. Nothing. We didn't ask anything. There was no eligibility criteria to enter this bus. And for me, it was a fantastic experience, because in this bus, a lot of people living with HIV and AIDS were participating. They wanted to be part of something new that was created in the canton of Geneva. And this was very key, that the community, since the basis of the political program, this was a political decision, as you said, Lord Fowler. Nothing could have been could have happened without a political will. That was extremely how do you say, audacious. It was very new, innovative at this time for the politician to say we will just allow everyone who wants to have a syringe to have a clean syringe, because we don't want those people to get HIV and AIDS and hepatitis or any other diseases. So this was my first experience also at the time where there was no highly active antiretroviral treatment, where the vast majority of the PLW, the people living with AIDS, were just dying. And most people I have known at this time, they just died. So it was a very difficult period, 1992. And then I decided to do medical school. And then at the end of my medical school, I went to see Bernard Hirschel. Bernard Hirschel was one of the infectiologists, well known for HIV and AIDS, and he was the leader of the HIV unit at the HUG in the Geneva University Hospital. And at this time, Bernard Herschel was also the director of the World AIDS Conference in 1998 in Geneva. So at this conference, maybe the thematic of this conference was bridging the gap, already 1998. And at this time, I didn't really realize what it does mean, bridging the gap. Which gap are you bridging? And people are dying. Even we were in 1998, we were having access in Switzerland to highly active antiretroviral treatments since 2 years already. I was very junior in my, just ending my medical school. But what really I saw during this World AIDS Conference was a shock for me. I was part of the medical part of this conference. So where there was, at this time, in all conferences, there were salles de repos, so people could come and rest because there were a lot of people living with HIV and AIDS who were really sick. They could come in the conference and have a space for, for rest, etc. And then I was a junior doctor there in this space where people could receive some care. And what I saw was really shocking. First, I saw that half of the people who came in this medical part of the conference were people coming from the southern part of Africa to get treatment. And we had to lock, I've been asked to lock the doors where there were the treatment, because I've been told you don't have any treatment for everyone. So you just close the door and you give the treatment only for those who can access, but not everyone. And I said, well, this is the conference was bridging the gap. And then you arrive and someone told you, well, yeah, you bridge the gap, but you just have to lock the door in order to be sure that no one will steal the drugs, the life-saving drugs, that half of the planet had no access to. So this was really my first shock. I mean, it was, for me, this conference was so important. But the second shock that I had, which was a more positive one, is that most of the people I received during this conference were US activists. And the US activists, they knew much better than I did everything regarding HIV and AIDS. So this was also for me, as a young doctor, a very important lesson that the community, the people affected with HIV and AIDS, were knowing their disease. They were part and involved in not only in their own individual health, but they were involved in the politics of how to access drugs. They were also involved in the public health issues, and they were involved in the research. And for the first time, also, it completely changed my mind in terms of how to be a doctor in a different community. For me, being a doctor since this time has never been the same. And even so, now in 2022, in my current practice, it has changed. I see less activists in my consultation than I did see in 1998. Well, the world has changed probably, and even the activist associations, it's not exactly the same now in 2022 than it was in 1998. But still, it was for me one of the main lessons from the early days of the HIV pandemic, is that the community has to be involved, and not only involved in, individual choices, but also in public health choices, in politics. And nothing could have happened without the community involvement, because we had also to push politics. We needed to have the politics involvement, and I like the policy and politics. It's clear, but we needed politics, policy, and we needed also the community to be engaged. And because of this engagement, the international market rules could be changed. I think it was the Doha Declaration that changed the market rules to access the drugs. At this time, it was maybe 98, if I mistake. 2001, yeah. It was after MSF received the Nobel Prize for for the Peace Nobel Prize. So, I mean, I think the activists, the politicians, the scientists, everyone needed to be engaged. It was not only a one-person involvement, but really the corpus of this involvement make change the rules of the market. And today with COVID, I'm really hungry, because we are not hungry. I'm sorry. I hope hungry, because no, I'm not hungry at all, because it was really good. But it's always difficult for me, this English issue. But I am really hungry, because what we experienced after 40 years of lessons of HIV, after 40 years we really battled to have access to drugs. We wanted to bridge the gap. You know, after all these years of community and political engagement, after all these years, we realized that we were not able, as a community, as scientists, as politicians, to make sure that the planet, the whole world could access vaccines, that the whole world could access drugs. And this, for me, is really a failure. I don't exactly know why it was like this, because if you would have asked me 5 years ago, I would have told you that AIDS has changed the world, has changed the politics, and has changed the way we see equity and access to, free tests, vaccine, drugs, etc. But it didn't, or not sufficiently. And this is really a failure, because a lot of time I say AIDS and the answer to AIDS, I mean, AIDS has changed the way I did medicine, but AIDS has also changed politics. And why it didn't succeed with this pandemic now, with COVID-19, and why it didn't succeed even in my own country here in Switzerland. If you can imagine that the monkeypox vaccination have started 2 days ago. Now the epidemic is over. So there is something that did go wrong, and we have not taken all the lessons that you so wonderfully, my two previous speakers, I mean, you have so wonderfully shaped the AIDS answer. But I would have wanted that this AIDS answer have led to durable change in politics and durable change in how we can do science. That science is not, something that is protected from the life. Science is just part of the world. And as scientists, I think we all have a responsibility to fight to get what we want. And today, I have to say that we have learned a lot from AIDS. We have succeeded, as you said, to have 75% of all those who in need who access drugs. This is wonderful, but it's not 100%. We probably have not reached all those who need to have the preventive drugs for AIDS, the PrEP. I mean, we are far from reaching the number that we think should receive the preventive drugs to prevent HIV acquisition, whether in Europe or even in other parts of the world. So I would like to end to say that I understand, I agree, I couldn't agree more. This is a wake-up call. We cannot end now. We haven't succeeded. I don't think we have succeeded because we were not able to translate the AIDS lessons to the COVID-19 and monkeypox lessons. And this, for me, is what I would like to transmit to younger and students here. You have your part to play now. There will be new pandemics, unfortunately, but we know it will be new pandemics. There is already the Ebola Sudan now in Uganda. We need to be very watchful and careful on what is happening, because even as scientists, we have this responsibility to make it succeed for other pandemics. Thank you very much.